My name is Dr. Levitin, and I'm the director and the founder of Open Sinus, Ear, Nose, and Throat here in New York City. We started this office dedicated to treating patients who are suffering from changes in their ability to breathe well, people who had not responded to medical therapy for chronic rhinitis, chronic sinusitis, and overall not breathing well. I think what makes Open Sinus unique is that we've dedicated our entire practice to a non-surgical approach. Even though I'm a trained otolaryngologist and I was trained to do nasal surgery, for the last 10 years, I've eliminated all surgery from my practice and only focused on office-based solutions. A lot of times, these patients have been suffering for years. They've seen other doctors. Sometimes they've even given up for a while, and they're coming back into the medical community to see if there's any other new options that may have changed. So when we are talking to patients about the Neuromark procedure, what we're really explaining to them is that how technology has changed. In the past, this was looked at as a surgical procedure. In fact, it was done exclusively when it was begun as a surgical excision of a nerve in the back of the nose. But instead of doing a surgical interruption, we are now adapting our technology to the needs of the patient. I think Neuromark is a great option for patients who are suffering from chronic rhinitis. Neuromark is what I call the exit strategy. Once someone has maximized medical therapy and their symptoms are still having either breakthrough or they're not tolerating the medication on a yearly basis, because again, a lot of these patients are using medications every day because their symptoms are every day. So when you look for a strategy on how to exit that ramp, what you're really saying is, hey, here's a procedure that can reduce the burden of your disease. Neuromark treats the posterior nasal nerve. It treats the targeted areas in the back of the nose of where the problem arises. So when I think about telling these patients that we have a treatment for them, we're looking to make an improvement at least 50%. That means that people have 50% less symptoms of congestion, 50% less drip, and they're breathing better by 50% or more. Those are the type of differences that one procedure can make. The typical procedure day is where they walk in, they sit down, and we begin an anesthetic protocol. That protocol takes about 20 to 30 minutes to make their nose completely numb. And then 5 minutes later, the procedure is done. The procedure itself takes less than 2 or 3 minutes. And then afterwards, they can walk out, usually within 45 minutes to an hour. Again, functional, no downtime, able to go back to work, able to go back to their families, eat a normal diet. There's really, like I said, a huge benefit and a very low risk profile to these type of office procedures. And I think most people say that it was easier or even less invasive than they thought it would be. A lot of times they compare it to a dentist, and I think my best compliment is that was easier than a dental visit. We can't cure the air we breathe. We don't live in a bubble, and we all have temperature fluctuations and environmental changes, going from home to work. But those type of fluctuations should be minimized by this type of procedure, which means the patients are more resilient to their environment, they're more resilient to changes, and they're more tolerant to changes as well. We don't cure anything 100%, but when you can make a difference of 50% or more with little to no risk of anything getting worse, those are real game changers.